So during this EBMT annual meeting, we are presenting data from our retrospective analysis at the National Bone Marrow Transplantation Centre in Tunisia. In this study, we analyzed the incidence and outcomes of transplantation-associated thrombotic microangiopathy, or TA-TMA, in 243 patients transplanted with hematological disorder. In fact, the diagnosis and management of this severe endothelial complication remain challenging, especially in transplant centers like ours, where access to specific biomarkers and targeted therapy is limited. So we use a Jordan clinical criteria except for the soluble C5b9 parameter. We also explored the EZIX score across different times post-transplantation. The EZIX score is an endothelial association and stress index. It is a sample biomarker that may predict TA-TMA after transplantation. So in this study, we have 5% of patients who developed TA-TMA after a median time of 2 months post-transplantation. We identified acute GvHD and microbiologically documented infections as significant factors associated with the occurrence of TA-TMA. So this finding supports the concept that TA-TMA results from the cumulative endothelial injury in the early post-transplantation period. On the other hand, the 3-year overall survival was significantly higher in patients without TA-TMA, whereas non-relapse mortality and EZIX score were significantly higher in patients with TA-TMA. However, TA-TMA-related mortality was 22%. Finally, 2 key conclusions emerged from this study. First, the diagnosis and the incidence of TA-TMA in our study is probably underestimated because specific biomarkers, especially the soluble C5b9, are not available. Second, limited access to complement targeted therapy, especially eculizumab, may contribute to higher TA-TMA-related mortality.